progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Palmdale Regional Medical Center recently won a Stroke Gold Plus Award from the American Heart Association and the American Stroke Association. Here to tell us what that means for patients that might be suffering a stroke is my guest, Michelle Irving. She's a registered nurse and the Stroke and Sepsis Coordinator at Palmdale Regional Medical Center. Welcome to the show, Michelle. So tell us a little bit about this award. What is the Stroke Gold Plus Award?
Hi, Melanie. Well, the Gold Stroke Plus Award is an exciting award to achieve. It's the highest award through the American Heart Association, American Stroke Association, Get with the Guidelines. And really that award is saying that you're providing quality care for your stroke patients and that you're achieving your measures, which I can go over, but you're achieving them at 85% for 24 months. So that means that for these last 24 months, we've been providing our patients with quality stroke care, providing them with the proper education and medication for stroke.
So tell us about the criteria. What's involved in getting that kind of a high distinction?
So one of them is making sure that when our stroke patients come in through our ER, that we're checking them out as quickly as possible, that if they're coming in and they've just had a stroke, and they come in within that 120 minutes, that we would be providing them with TPA, which is a clot-busting medication to dissolve a clot if someone is having an ischemic stroke. We're also providing antithrombotic therapy, so that's giving them something like aspirin, and that helps to thin their blood if they potentially have a clot. Or there's other medications that we can provide based off of the doctor's decision. Also, education. We're providing them with medication if they have a heart condition that is AFib or AFlutter, which can put you at risk of having a stroke. We're also providing them education on smoking cessation if they are smoking. And we're also providing them with cholesterol medication if their LDLs are above 70. So we're following those measures over 85% of the time within the last 24 months.
Michelle, is this something that a hospital receives just out of the blue, or do you apply for an award such as this? How do they recognize you?
So we're recognized through data collection. So we have a really amazing quality department here at Palmdale Regional Medical Center, and they actually have to input individual data for all of our stroke patients that come into the hospital. So we have a great team that they're actually looking through each patient's chart. So they're doing concurrent reviews, and they're doing and making sure that the patient is in those guidelines, in those measures. And when they're not, we're following up with the physicians and saying, hey, can you this patient's LDL is a little elevated. Do you recommend us, giving the medication for a statin, like a cholesterol medication? And so after that, we're also looking at the charts after the patient is discharged and making sure that the doctor did everything that they needed to do, but also just our stroke program in general. And then if we have done that, and if we haven't, we still have to submit that information to get with the guidelines. And so we have data throughout the year, each month, for each of our stroke patients that have been discharged, and we look at if we met those measures. And which is really exciting. We met those measures above 85% of the time. Sometimes it's 95, sometimes it's 100, sometimes it's 86, but we're meeting those measures, and it's helping us to see how we can improve. So when we're at 86% one month, but the previous month we may have been at 95, we can look and say, where do we need to improve in our program to provide the best care for our stroke patients?
So it's like a big database of great advice from the American Heart Association, American Stroke Association, right? So all hospitals kind of put their data in there, and then they helped you to measure what you need to change and improve?
Yes, they help you measure what you need to change and improve based off of what data we receive. So they have set standards of measures. So they have those criteria, making sure that a patient is educated when they are a stroke patient, making sure they're started off with like VT prophylaxis. So that would be something like a ThromboGuard, so that when they're laying in bed, they have like leggings that provides massage to their legs to prevent blood clots, making sure that they're on an antithrombotic medication or anticoagulant medication based off if they've had heart condition problems like an AFib and A-flutter, making sure that their cholesterol is being measured, and if it is high or elevated, to provide them with the proper medication. So it gives us a set standard of what we need to do, and this is based off of evidence-based practice and many journal articles through the American Heart Association and Stroke Association saying this is the best practice of care for stroke patients. So they provide those measures, and then those measures we follow that throughout that patient's stay if we met those measures. So that helps us to know that we did the best care that we can with that patient. And if we've fallen off, we missed a medication, it shows us how we need to improve, how we need to educate our physicians, or how we need to even educate our nurses if they're not providing the proper education for our stroke patients.
So my next question was going to be, what does that mean for the hospital? But it seems like it's really an increased educational, award for your nurses and for your doctors, and an incentive for them to keep re-educating and keep up on the latest advances in stroke care.
Correct. Yeah, and it really shows us how we've improved. We were Silver Plus last year, and we received an award at the recent American Heart Association, American Stroke Association International Conference in Los Angeles. So now having received that Silver Plus from the previous year, and knowing that this year, based off of 24 months of data, that we are improving, it just shows that our stroke program is getting better and that we have buy-in, and we're a team with our RNs and our physicians. And so it makes us want to do better, and it continues to help us become team-oriented and working together. And not only that, but it also helps not just the physicians and the RNs, but also our rehab therapy, because in one of those measures, and I forgot to mention, it talks about if a patient has been assessed for rehabilitation. So making sure our stroke patients are receiving the physical therapy, the speech therapy, and the occupational therapy. So we're a team, and it shows that by us going from Silver Plus to now Gold Plus, which is the highest award you can achieve.
And now, what does this mean for patients? As you wrap up for us, Michelle, give your best advice on even preventing a stroke, but on the educational aspect that you've discussed for all the healthcare providers. How does that translate to better outcomes and better care for the patients?
Well, this translates to better outcomes for our patient. One, when our patients come to our hospital, they're going to be provided the best quality care with any disease or condition, but with stroke care because of this award. So we know what to do for our patients. We know when they come in through the ER, or even if there's a cold stroke inpatient, we know from the beginning to the end what to do. We know what we need to track for our patients, the medications they need to be on, the labs that need to be drawn, and the rehabilitation that needs to be provided for them, as well as education. And so we're helping our patients hopefully decrease their risk of long-term disability, which stroke has the highest rate of long-term disability. So that's our goal, is to prevent disability and death, and making sure that we can, if our patients come in with a stroke, we can provide them with the best care possible to prevent long-term disability, and through that, starting early rehabilitation, starting early medication and VT prophylaxis to prevent a future stroke, and to educate themselves on how to prevent a future stroke for themselves by decreasing their cholesterol levels, educating them on the warning signs of stroke, going over fast with them, and making sure that if they have family involvement, that they also know, because we do know that those who have had a stroke are at a risk of having another stroke. And so we want to make sure that they know the warning signs of and how to know if they are having a stroke, how to come back to the ER very quickly to, once again, to prevent that risk of disability or death. So I believe that this Gold Plus is helping us increase our standards, heighten our standards to provide the best care we can. And we're doing it in a team effort, because we could not have gotten Gold Plus if it wasn't for the assistance of the physicians, the RNs, and the rehabilitation team.
Thank you so much, Michelle, for joining us today. And congratulations on the Stroke Gold Plus Award from the American Heart Association and American Stroke Association. It certainly is a big, huge plus for the patients in the Palmdale area who might be suffering stroke. Thank you again. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.